Last August, I found out I was expecting our son, Owen, and we were very, very excited. We'd, been hoping for a baby, and so I started planning everything. Start looking for a new, bigger house, and everything was going fine. Everything was felt pretty good with the pregnancy, and then in January, late January, I was on campus working. I'm a professor at UNI, and I and anybody who's had a baby will understand this. I thought maybe I'd wet myself, but we went to the hospital just to be safe, and it turns out that my water had broken. We'd gone to Allen Hospital in Waterloo, where I had expected to deliver him, but they don't have a level 3 NICU there, so they put me in an ambulance and sent me to Cedar Rapids, to St. Luke's, where they do have a higher level NICU. I spent 11 days on bed rest, and they were able to give me some shots of things to try to help the baby's lungs develop, because 3 months early is pretty early for a baby. And on day 11 of bed rest, he decided he wasn't going to wait any longer, and was born almost exactly 3 months early. And he was 2.5 pounds. He was very, very tiny. And he had a whole host of medical issues, things that kind of go along with being born that early. His lungs weren't, completely developed yet. He had to be intubated. They had to put a tube down his throat at first. And they put some stuff down there to try to help their lungs expand. And then he had to stay on oxygen for the whole time we were in the hospital. He had a minor brain bleed because the blood vessels in his head weren't all the way developed yet. He was jaundiced. He had a whole host of medical problems. We ended up staying at the NICU in Cedar Rapids, which is about an hour away, for 65 days. That was on top of the 11 days that I had already been in the hospital. He was being taken care of by a whole host. I can't even count how many medical providers he had while we were in there. Everything from the nurses who did his day-to-day care, all the way to he had a specialty eye doctor, because having eye problems was a common issue with preemies. He had heart doctors and lung doctors and respiratory therapists and everybody. And we started getting the bills for his care, and luckily we have very good insurance through the university. But as of now, so what is it, September, 9 months later, that baby's worth about $500,000. Luckily we met our out-of-pocket maximum a while ago, and we don't have to pay all that. But if we didn't have the good insurance that we do, I don't even know what we would do. It's very, very expensive, it turns out, to have a preemie baby. And we were told at the beginning, the hospital does a very good job of informing you about the things that are going to happen and the things that you're eligible for. They let us know that he would be automatically eligible for Medicaid, which is great. So it would have been a backup if we had not had the insurance. But at the same time, all the news is going on about what's happening with Medicaid, and the privatization and the bills not being paid, and whether we're even going to have it. At the federal level, the president is now threatening to to make cuts to the Medicaid budget. It looks like they're going to raid that budget to help pay for tax cuts to corporations and stuff. And so all of this is going on at the same time as we're being told that, oh, don't worry, if your insurance doesn't cover it, Medicaid will. It's like, I'm actually not sure that that's true. So I am fully in the court of being a healthcare voter. I was before, but especially now that I've had this experience and I understand more fully what an absolute disaster it would have been for us had we not had the appropriate health coverage to pay for, or heck, if we hadn't been able to afford our out-of-pocket maximum to pay these ridiculous bills to 5 billion different medical providers that helped keep our baby alive.